Jackie wants to know, in regards to avascular necrosis, she says, please suggest a way of avoiding or delaying hip replacement due to chemo drug side effects that induce the avascular necrosis. She says, I need a way to bring oxygen to the area and stop further tissue death.
Well, number one, it's good to have oxygen in the body, but oxygen would do very little to stop bone degeneration and fragility. What one has to do that is not only get the prerequisite nutrients. Number one is silica. The best source we found in North America and much of Europe is from a company called BioSil. It's about 2.5 times more digestible. Now, the good side effect of this is it helps skin and hair too. Because I lift weight as one of my many hobbies, I literally have been taking this for a number of years, and my hair now grows so rapidly I get it cut 4 to 5 times extra a year now. This helps everything in the skin, and even to the appearance of the skin, but it does help more than any other nutrient, bone regeneration. Number 2 is strontium. Not calcium, number 2, but strontium. And there's good organic sources of mineral strontium out there, which is generally taken in trace amounts. But when you have major deficit like we're talking about now, in a pressure area, the problem with the hips is that you need bone there. Boy, do you need bone there. Because you have a crazy amount, hundreds and maybe even thousands of pounds of pressure if you're running and putting, stressing and holding things on that particular part of the bone. So strontium's number 2, and I would take it in copious levels for the first 120 to 180 days. And then, of course, a digestible form of calcium. Hippocrates offers one called VegCal. As far as we know on the entire planet, we're the only ones now extracting from a vegetable calcium. Almost all calciums on the market today are made of oyster shells, zero digestible, or chalk, not only zero digestible, but also carcinogenic. And so make sure you're taking the right forms of calcium. Liquid forms may be digestible, too, from companies like Aniva. Not quite as good as the VegCal, which has the proper ratios, biological ratios of other nutrients in it. Now, besides all of that, and foremost, even before the nutrients, would be the very, very effective use of electromagnetic therapies, even going back to the old school generation of diathermia. That's therapy done from machines called diapulse machines. And those machines literally can be found globally, usually with naturopathic or chiropractic or very enlightened medical faculty. And diathermia is one, but then coming up to the newer generations like Bio4. And Bio4 is something we use here quite effectively for such situations. But there is a time and there is a place, by the way, that a surgery is going to be required. And without having our medical team here look at a scan, I cannot speculate and tell you that you do or you do not need an operation. Because the last thing you want to do is not have an operation when it's needed, as bad and as horrible as that may be, and then fall and be in a lot bigger complication than just getting a small operation on the hip.